those tight lower back muscles are a contributing factor. And if you never forward bend because you're afraid to hurt your back, then in an indirect way is contributing to the problem. If we're going to create the perfect strategy for spondylolisthesis, say the goal is to avoid surgery, avoid a spinal fusion, and get out of pain and get your life back. And the very first thing is you have to avoid the causes. If you have a thumb injury and you want it to heal, and the injury is from hammering your thumb, you have to stop hammering your thumb. The cause of a spondy is often too much backward bending. And so to be able to get your posture and your core connection to be able to live in a more neutral position, or if you have an existing spondy, actually sometimes it can be beneficial to live in a more posterior position, posterior pelvic tilt, and you can see that the lumbar spine decreases its extension or its backward bending when that happens. It should be a goal to have a resting posture that it looks more like this rather than this. And it is very beneficial for a spondylolisthesis. Not just spondy, but lots of back pain conditions. Bulging disc, herniated disc, stenosis, degenerative disc disease. Number 2 is align and stabilize the region. There is an alignment problem. And a spondy could be something like this, where the L5 has slipped forward on the S1 and it's out of alignment. And so you want to get that back into alignment. And the nature of a spondy, as we talked about last week, is that it's an instability. It's potentially can move. As in my experience with my spondylolisthesis started with a traumatic event, and then I could feel it shifting every step that I took for a very long period of time. It was unstable. And so you need to align it, but then you need to stabilize it. And you can't align and then stabilize, because aligning it, say you get a chiropractic adjustment and you align it and then you go home, it's just going to fall back out of place unless you immediately follow it up with stabilization. So we'll talk about my strategies that I've used to align my spondy and how I've stabilized it. And so we need to increase the tone in the abdominal muscles, and not just the six-pack abs, actually not the six-pack abs at all, the deeper abdominals. And it's not just one, there's a group of them, and you don't need to single out any one of them. You don't even need to know the names. We'll just call them the deep core muscles. They look and act like a corset. And so these muscles, you can increase the tone, and they are built for endurance, not for power. They can actually maintain the pubic bone in a forward position throughout your day, and you can actually function and do other things with that tension there. Now you can imagine the sheath. They wrap all the way around the rib cage as well. It's an incredible opportunity to provide a stability to this section of your spine, this midsection that we're trying to stabilize. It's a muscle group that is in place of the lack of bony support that the rest of the spine and body has. And then the third and very important piece of this strategy is to mobilize the regions of your body above and below the injury. You can see this L5 has slipped forward. There's the front edge of it, has slipped forward on the sacrum. And so this is a spondylolisthesis. This region of the spine is unstable. By far, the vast majority of spondies are in the lumbar spine. It doesn't have the bony support that the rest of the spine has. Look at this part of the spine. It has tons of bony support from the rib cage. But here you have this open region where we're reliant on our core muscles to provide the stability, and the predictable pattern is that our core muscles tend to shut down. We're not using them as much as we need to in this modern day and age where we sit a lot. And the same thing for the hips. Our hips tend to get tight. All the muscles surrounding our hips decrease the mobility of the hips. And so if we're going about our day and we're going through life and we need to reach over and bend back and drink out of a cup and look up at a bird or do whatever, even just walking, and all the movements going into this region, it's not going to allow this instability to stabilize. This movement that happens here, it's just going to continue getting that movement. And so the goal would be to take the load off of this region of the spine. Not only have we stabilized it, in order to take the load off of it and still be able to function and do the things that we need to do in our life, we need to have some mobility somewhere. So increasing the mobility in the joints of the thoracic spine and increasing the mobility in the hips so that we can do things like go to a yoga class or do a sport or an activity that we enjoy and still have the mobility in our body without all of it going into this one segment that is taking the brunt of all the movement all the time. Now, what are some actual things you can do? The first thing is, if we understand that the cause of spondy is usually related to backward bending, then it would make sense that forward bending is actually not that bad. So just allowing for that sometimes can offer some relief and not solve the problem, but maybe stop contributing to the problem, because those tight lower back muscles are a contributing factor. And if you never forward bend because you're afraid to hurt your back, then in an indirect way is contributing to the problem. Number 2, pillow relief. So you're using the pillow as a physical force to push the spondy back in the opposite direction. You take this person and you have them lay down on their stomach, prone, and you put a pillow right here in the perfect spot. It could be applying a force in the opposite direction to try and just gently push that part of the spine in the opposite direction. And so that would be part of the alignment goal. So I have used this a lot in my journey to not only help with the alignment, but when you do get the alignment back in place, it reduces symptoms. It can reduce sciatic symptoms from the spondy. It can relieve your lower back muscles of just that chronic tension that they feel. And it's just a very relieving position to be in, to have that pillow just gently pushing up. I have made an entire video about this, and it's on YouTube, and I go in detail about exactly where to put the pillow, how to know the landmarks of your body, and to use those landmarks to place the pillow appropriately. So anterior to posterior does refer to a spinal adjustment, and so this can be done by a manual therapist on this vertebrae right here, and just giving it an adjustment in the posterior direction. But you cannot correct an alignment in your body and then just go on with your life and your day and expect it to stay there, because there's a reason your body got out of alignment. And so you absolutely must immediately follow up alignment with something that will help keep it there. So we'll call that a stability exercise. And so that's what we're going to lead into with these last 2. And I believe they are absolutely the most beneficial thing you can do. So the six-pack abs is only the surface layer abdominal, and it's designed for movement, but the muscles underneath are broad, much more surface area to compress and squeeze and provide stability. And you can see they all connect in to a point at the pubic bone. And if you can achieve a connection to your pubic bone, then you can start doing incredibly effective exercises like the bridge without hurting your body, because the bridge is an exercise that many people have tried for lower back pain, etc., and it often can actually cause more pain, and they're doing it without that pubic bone connection. They're increasing the arch in their lower back by doing the bridge. But if you can learn how to do the perfect bridge, as I call it, with a strong pubic bone connection, you can apply this to an exercise that can have a magnificent effect on your body to help you achieve muscular balance. And it's one of the most powerful tools that I know of to help restore muscular balance in the body. So that's it. And it's not just the bridge that you can apply this connection to. It's everything that you can even think of, from exercises to something as simple as walking. And it can completely change the effect that walking has on your body if you can learn to walk with that pubic bone connection engaged, not just for a moment, but for a span of the entire walk. And your body can feel really good after doing something like that, because you're getting that healthy movement without causing the damage. Thank you guys all for being here. Until next time, down on the floor and connect to your core. See you next week.